Family income support for 20 years has been inadequate for low-income families. There was no indexing of family income support for 20 years, only rectified in 2008. In 1991, the universal family benefit was abolished. And in all of this, the beneficiary families, as John so clearly illustrated, have been treated very harshly. The benefits were cut and not restored relatively. In 1996, the child tax credit was introduced, excluding children of beneficiaries, for the first time 2 classes of children. And Child Poverty Action Group took this case against the Crown, that the Working for Families, which is the same tax credit, in-works tax credit, and the Human Rights Tribunal in 2008 found that this constitutes real and substantive discrimination against children. So we have a fact here. And so in New Zealand, if we look here at this graph, we see on the left-hand side the families, people living in income-tested benefit households. In the middle are us, people like us. And on the right are those over 65 who are all supported by government superannuation. And we have this real paradox in New Zealand that John also talked about, that we have far more children in beneficiary families in severe or significant hardship, those in the red and the orange, than among the elderly who are also supported by welfare. So we have 2 welfare systems in New Zealand, one for the elderly and one for children. And the children one is mean and has driven them into hardship, and their whole futures are at stake, and our futures are at stake, because they're going to be the adults of the future. So we've got a crazy system here, and yeah, I'm pretty concerned about it, as you can see. Let's just have a look at who's on benefits, and this data goes from 1986 to 2008 and shows the 3 different types of benefits, and you'll see the green triangles are the domestic purposes benefit over time, and you'll see what's clear there. There's almost very little change over time. So we haven't got a sudden burgeoning of numbers of people on domestic purposes benefit. What we do see is the sickness benefit and invalid benefits going up. What I want to point out to you is the benefits were cut in 1991, but this did not drive people off the DPB into work. So cutting the benefits, which is the subject of some discussion with a future focus bill, has no evidence from New Zealand that this will work to get people into work, not that alone. So in the 1990s, we had a New Zealand experiment of a stick, which was cutting benefits, rather than a carrot, which would have been lifting wages and lowering taxes for the low paid. And this failed, and it damaged our children. And it continues to do so unless some policies change. I'm getting a bit sick of seeing one new child with severe bronchiectasis every 10 days at Starship. So cutting benefits clearly doesn't incentivise parents to take up work for many reasons, including that their children need their presence and care, and that would be especially so for younger children or for ill children, which are more likely in beneficiary families, or disabled children. Childcare is not accessible or affordable. There are not jobs at child-friendly hours. There's no local availability of jobs. Jobs are too lowly paid, highly taxed or insecure. So I hope that the Social Assistance Future Focus Bill will be crafted to reflect this evidence and improve, not worsen, the poverty of New Zealand children and their long-term damage. The final data to show you is about sickness and invalid beneficiaries, and this shows data by age group and shows the increase, the changes at least, or in fact the increase by age group from 2002 to 2007. And you'll notice a remarkable thing here, that the groups with that's the younger age group, 18 to 24, have got the most marked increase in numbers going on to the sickness and invalid benefit. And I ask you, how much of this is due to physical and mental disease as a result of the increase in child poverty and long-term being in disadvantage or disease? And at MSD don't have this data because I've just asked them about it, and I have a research student looking at this at the moment, but I'm saying we don't actually know the answer to this question. It's in a very unusual graph, this one. You wouldn't expect so many young people on these benefits. So I do worry that it's a result of the damage through childhood. So my final slide is how do we look after children and improve their outlook in the Welfare Working Group review? New Zealand must look at the impact of all policy recommendations on the most disadvantaged children first, not last. New Zealand must improve the situation for the most disadvantaged children, not worsen it. New Zealand must investigate the reasons for the high number of younger people on invalids and sickness benefits before developing any policy recommendations. Notwithstanding that, New Zealand policies must be aimed at reducing the number of people on New Zealand policies aimed at reducing the number of people on invalid and sickness benefit must address root causes in childhood. Nā tā tātou rōrō, ka ora ngā tamariki. Thank you.